to Module 3 of the Couple and Family Religion and Spirituality Competency Training, Family CARS, where we're focusing on assessment to build competency in addressing religion and spirituality in families.
Now, the objective for this unit is that you will be able to integrate 4 great questions about a couple or family's religious and spiritual identity and intake. And as a preview, the 4 questions are: 1, identity. What is the religious and or spiritual tradition or belief for you and your family? 2, prominence. Now, how prominent is RS in the family's daily life together? 3 is role. What role does RS have with the current concerns? And 4 is inclusion. What would you like to include about your RS practice in therapy? Now, these 4 words spell out the word IPRI, I-P-R-I, which really isn't a word, but it helps us remember the 4 questions for identity, prominence, role, and inclusion. And we're going to start our discussion with a family therapy case.
Carmela has brought her 10-year-old son, Will, in for counseling. He has been diagnosed with ADHD and bipolar disorder. They are an African-American family consisting of mother and son. They are deeply involved in her brother's mosque and her grandma's African Methodist Episcopal Church. Carmela describes the financial and practical support she receives from these communities. She gives back through her political involvement, which gives both her and Will a sense of purpose in their community. In private, Carmela is worried about her son. It has been suggested that he might be cursed or possessed. She says that her brother doesn't think so, but an older woman at the AME church said, "He whispers all the time." This worry is weighing heavy and frequent on Carmela. She has brought him to family counseling to see if you can help them in any way.
What you need to know about the role of religion and spirituality with the couples and families you see. You likely already have some way of assessing the family system and the important variables in couple and family therapy. Diversity is part of that assessment, and, quote, fitting in religion and spirituality to a tightly packed assessment period may seem overwhelming. Good news. We're here to offer a sensible, simple strategy to effectively understand how religion and spirituality fit into the assessment and the initial conceptualization of your couple and family cases. You wouldn't think of avoiding asking about race and ethnicity, socioeconomic status or gender, or sexual orientation. Spirituality can be just as foundational to these families.
The first essential question is, what is you and your family's religious and spiritual tradition or traditions? The purpose is to define their RS identity. Like for Carmela and Will, there might be a plurality of traditions and identities within the same family. We suggest you ask a question like the one that's on your screen. An open-ended question is often helpful to let them define for themselves how they want to define spirituality or religion. You might consider putting a separate question for spiritual if that's common in your community, since religion and spirituality could be separate constructs or they could be seen as the same thing. In fact, this can be crucial, actually. Some people will identify as spiritual and they have negative associations with religion, and separating them into 2 separate questions can help people feel engaged, or at least doesn't unintentionally drive them away. But this can also work in reverse. Many people identify as religious within a specific religion or even their denomination. And if you use the word spirituality, sometimes they perceive in their minds that you must be secular and that they might even infer that you are opposed to their religious identity, which is unlikely to be the case, but often assumed by highly religiously engaged people. So if you can ask a nice open-ended question or separate religion and spirituality to 2 questions, even in the mental health profession, we kind of often lump them together, but this makes for good client first contact for client relations.
A second written question addresses prominence or importance. This can be asked in a simple 5-point response option question. How important is spirituality or religion or faith in your life? We recommend all of these words because they have different meanings to the people you may see. They would be rated from not important to vitally important. These questions give you a bit of information heading into the first meeting. Does the family have different religions or the same? What kinds of religion or spiritual language and ideas might they resonate with? Different clients may have strong preferences for the religious language and the terminology used.
And some people will want their particular religion referenced. For instance, you might say your Hindu tradition, while others may want more general spiritual language like spiritual or faith. You might have an open discussion with your clients about what language they use and acknowledge with them that within their own family or religious group, there is likely a whole lexicon of terminology. You're going to join with their family and you want to use their language as much as possible. This early paperwork can help you cover at least identity, but you can follow up on that in the intake interview regarding religious identity in their community or not, or other nuances of their identity or identities as a family. In your intake interview, the next question, and it's a great question to ask in couple or family interview, is about prominence. We borrow this question from Dr. Ken Pargament, who's an expert in the psychology of religion. The question is, how has, insert their faith tradition here, like your Jewish faith or your Buddhist tradition or your spirituality, helped with this problem in your family or relationship? And how has your faith tradition contributed to the problem?
This question is ripe for follow-up inquiry. Perhaps they have religious tensions among family members in the room or those outside of the room. Or they may have practices that bond them together. Perhaps a family sees their relationships as sacred and holy, blessed by their higher power. Maybe their family problems make them feel shame or question whether they have violated a sacred blessing. Others may have experienced religious prejudice and feel like an outsider in their community or even their own family. After you have asked about various aspects of diversity, a second follow-up observation and question could tie their religion faith to other aspects of diversity, noting the intersection of the various parts of themselves. Let's apply this to the case of Carmela and her son Will. You might say, Carmela and Will, I grasp a clear image of who you are and how you address your concerns. I see the important presence of these components. One is that there are two religious communities within the African American community that you both have experienced. What role do these play in your family together?
This is a very broad and open question. So how they answer the question will be telling about what aspects of diversity might be most salient to each of them. But if you left out the religion or spirituality aspect, they might go silent and hide that part from you, thinking that you wouldn't understand them or that it isn't welcome in your office. Notice we also recognize the intersection of race and religion and how this question was presented as a potential important intersection for this family.
If a family is not engaged in formal religion or spiritual practices, you might instead ask about how they uniquely create meaning in life together as a couple or family. Or you might explore deeper questions about death and birth and love and marriage, if they're married that is, in their own unique way. All humans have ways of addressing the existential issues of life, whether through traditions or forging their own path. This isn't an add-on to their understanding. It's a central part of being human and living in a couple or family context.
Okay, so far we have explored identity, prominence, and role of religion in the family. So our fourth great question is about inclusion. This is most important if you find that spirituality or religion has a high interest and the family sees it as part of their purpose or their problems. You might ask a question like, how would your spiritual practices, if that's their language, help in your counseling? This could include many options that the family hasn't considered, such as engaging with their religious leader for spiritual care, prayer for their relationship or family, using spiritual practices such as yoga, forgiveness, humility, or acceptance, or loving kindness as pathways to change. Co-creating a plan with the family with these practices can be a really enjoyable experience in treatment.
But not everyone agrees on their spiritual ideas and practices. Some families have tension. Family therapists can help the family find new ways of relating around religious and spiritual tensions. These can be rich areas to address boundaries and differentiation in therapy. These include non-anxious presence, multi-directed partiality, differentiation of self, and especially the exclusion and embrace, which is to respect where they are different from each other and embrace similarities. Couples and therapists get caught on differences. However, every RS tradition has a focus on how adherents are to live well with others who are different from themselves. As you have inquired about the aspects of religion or spirituality, you now have a complex and rich understanding of how the family relates and interacts. This understanding should be included in your conceptualization. Every theory of couple and family therapy is different, but we offer an example here of how you might conceptualize spirituality within a family context.
So you might see Carmela as dealing with unmet attachment needs in her relationship that are exacerbated by shame and having a son with disabilities and odd behaviors. She wants to be blessed and encouraged by her religious communities and family, but she may feel blocked from that goal due to her son's diagnosis. The fact that she is involved in two religions could set her up for conflicts between the communities, especially if there's a sense of competition between them. And Will may also have internalized this. This could trigger misbehaviors that express his anxiety. He may feel rejection and loneliness, and there's a threat to full engagement in their religious communities. Especially if that older woman's comments about Will being possessed were to become gossip, or maybe if it was a belief that the leaders in the community also agreed with and that Carmela looked up to. Carmela strives to be a good woman, and she's inspired by her religious ideas, but she's caught in this cycle. The context and content of their pain is rooted in some religious ideas, and if we would have missed that, it would have greatly decreased our conceptualization of what's going on with this family.
As you work within the layers of diversity to be inclusive of religion and spirituality, it is important to communicate with your couple or family your understanding of how diversity matters in your treatment. You'll have your own personal style and theory in how you address diversity, but a full picture of a couple's family needs to include understanding of them as individuals who carry experiences through their gender, race, national origin, language, SES, age, sexual identity, disability, and their religion and spirituality. This unit has introduced you to some basic and intermediate ways of improving your assessment of couples and families to include the important aspect of religion and spiritual diversity.
In review, in Module 1, we reflected on our comfort with religious and spiritual issues in family therapy. We introduced 4 great ideas about the therapist's qualities from family systems theories: maintaining a non-anxious presence, multi-directed partiality, ego differentiation, and exclusion and embrace.
In the second module, we introduced 4 great ideas that had come from the literature on religion and spirituality. These included religious coping, sanctification, forgiveness and humility, and prayer. The mnemonic for this one was, can someone find peace? CSFP.
And this third module introduced RS assessment through the IPRI 4 questions that can be done simply in written and intake questions. We need to directly ask how RS issues are playing a part, if they are. Religion is part of our overall diversity assessment, and RS contributes to our conceptualization of treatment goals. Thank you for your continued participation in the training program.